I don't think. Start our recording, and we have a poll that we are going to launch just to get to know where folks, who everyone is in the room. We started a little early, however, we can probably use this time to just get to know one another. So Vanessa, if you can go ahead and launch our poll on organization type, just to see who is in the room, that'd be really great. Thanks, Vanessa. So you should be able to see a poll coming up on your screen if you are on the computer, and if you are using your phone. If you're in the Zoom app, you should be able to see the poll. If not, feel free to switch over to the Zoom app from your phone and you will be able to see our poll. And it's just to see who's in the room. You can check to see if you are community health center, if you are primary care association, a national training and technical assistance partner, as well as a health center controlled network, government, academic institution, social service, or community-based organization, or other. And we will get started shortly. We'll give it about 1 more minute. And as you'll see, there'll be some chats in the chat box. So feel free to look at those when you have time. We hope it's not distracting. Alrighty. We want to go ahead and launch that poll so that we can all see the results, Vanessa, that'd be great. So it looks like we have a lot of folks who are community health center lookalikes, so that's really great. Looks like we have just a few folks actually in the room right now. So we are going to give ourselves a few more minutes to invite folks in as they come in. I don't know, Vanessa, if you can relaunch the poll.
Yeah, we could relaunch it.
Yeah, let's relaunch it. All right, looks like we have about 50 folks in our attendees list, so that's great. We're probably going to start a little early, so that's okay. We have quite a lengthy welcome, so we'll keep the poll up and available for folks. As folks come in, we will just check in on that a little bit later. But as far as welcome, once again, I want to welcome you all to today's session. And on behalf of the Special and Vulnerable Populations Task Force, I'd like to welcome you to our first webinar in our 4-part national learning series, which is focused on specific areas of diabetes continuum of care, which is a framework that is based on the Health Resources, Services, and Administration, or HRSA, which is a sponsor of this webinar. And as today's title suggests, our webinar today will be focused on the evolving roles of enabling services staff in diabetes management. Next slide. So I am Robin Barron, Project Manager at Health Outreach Partners, and I'll be serving as our moderator today. And I'm also joined by my colleagues, Cindy Selmy, Executive Director at Health Outreach Partners, Albert Eisen Jr., Associate Director of Training and Technical Services at the Association of Asian Pacific Community Health Organizations, Hansel Ibarra, Program Director at MHP Salud, Dr. Irene Hilton, Dental Consultant for the National Network for Oral Health Access, and Vanessa Reeves, who is an intern at Health Outreach Partners. Either I or Cindy will serve as your moderators for the NLS webinar series, and Albert and Vanessa will be working behind the scenes as technical support. So thank you to my colleagues for all the work that they've been doing for this webinar. Next slide. So if you are not familiar already with Zoom webinar housekeeping, I just quickly want to go through some of the features that we want to promote and engage with you all on today's webinar. So as attendees on today's webinar, you'll be able to use certain features. The first one is your audio on. If you click on the bottom left-hand corner of this, you will see that you will be able to mute and unmute yourselves using the microphone button. And if you click the up arrow on the button, you'll see that you'll be able to change your audio settings. However, for the duration of this webinar, you will be kept on mute. The next feature I want to showcase, and you can just click through this, Vanessa, is the Q&A. This is definitely where I want to highlight where you're going to divert all of your questions for the panelists and our speakers today. It'll definitely help the moderators and organizers today to help make sure that your questions are visible. If you make sure you put that is going to all participants, seeing that some of you might all have some of the same questions, we want to make sure that everyone's able to see your questions. So make sure that you click all participants so that everyone can see your questions. And for the Q&A, if it does help, please identify which speaker you want to answer your question. It might be helpful to put your questions here versus using the chat box feature so that we can directly address those to each of the speakers. And speaking of the chat box, I want to highlight the chat box as our next feature that you'll be able to use. So please do use the chat box to engage with us. There'll be lots of links in our chat box. We hope they're not too distracting, but they will be useful. And we hope that it's an interactive way for you all to engage with us. For the Q&A portion, if we do have time at the end, there is a raise and lower your hand feature that you will be able to raise your hand and we'll call on you and you'll be able to unmute yourself. So please do use that feature to raise your hand if you want to ask a question. And finally, at the end of the webinar, we do have a survey if you just do one more click, Vanessa. We do have a survey that you'll be able to be prompted to once you end the webinar. And we have a Q&A code for that survey, as well as a link to the survey at the end of this webinar. We value your feedback, and we will use this information to get from the survey to future webinars and for our learning collaborative in the winter. For those of you who are joining us and wanting some continuing education credits, you do need to complete the survey in order to receive credit for today's webinar. Next slide. So before we get going into the content today, I just want to emphasize that similar to our previous learning series last fall, this fall's 2021 National Learning Series and associated learning collaboratives in January of 2022 will take a deeper dive into topics that include the roles of enabling services staff, developing patient-centered resources, improving diabetes care, and health equity and management during a disaster in diabetes care and management, which all may help reduce the percentage of diabetes patients with uncontrolled diabetes of 9% or greater. And this series is built upon our last fall series, learning series, and aligns with HRSA's Quality Improvement Initiative, which I can hyperlink into the chat later. With that, I'd like to thank HRSA for their support of the Diabetes Task Force and helping to support health centers and reducing diabetes uncontrolled across the US. Next slide. This is our task force, who some of you may all be familiar with. There are 14 national training and technical assistance partners who have been collaborating for the HRSA task force for the last 4 years. We're really excited to continue into this 5th year to serve your needs at the health center level. We really hope that the trainings that we provide ensure that you're getting the information that you need. We also want to promote our new website. It's about a year old. Please visit us at chcdiabetes.org. This is where you can register for all our future trainings, including a learning collaborative that will happen next year. Next slide. And as you'll discover, our webinars will hone in on strategies for developing, supporting, and evaluating effective healthcare delivery models. They are designed for special and vulnerable populations with diabetes. So our task force members here today and our NTAPs who have organized today's webinar have been planning the last couple of months to ensure that today does build on our fall series. And hopefully some of our content is practical and useful, and you will be able to bring back to your health centers, and that it would build your knowledge base. And based on HRSA's recommendations, as well as these ongoing sessions and conversations, that will focus specifically on health centers, especially how you all can improve diabetes quality measures, and will bring some intersectional topics like COVID-19, health equity, social determinants of health, telehealth, etc. So please chime in during the session to let us know what you might need for future sessions. The Migrant Clinician Network is an accredited, approved provider of continuing nursing education by the American Nurse Credential Center Commission on Accreditation. This is where you'll get your CNE accreditation from, and you will, once you participate, you must complete a survey post the webinar. Once completion of the survey has been done and verified, each participant will receive an electronic copy of his or her certificate or their certificate. The planning committee members, presenters, faculty, authors, and content reviewers of this CNE activity have disclosed no relevant professional, personal, or financial relationship related to the planning or implementation of this CNE activity. This CNE activity receives no sponsorship or commercial support. The CNE also does not endorse any products. If you have any questions regarding your CNE accreditation, please contact Jillian Hopwell, and her email is on the slide. Next slide. As presenters, we also want to acknowledge that we do not have any potential conflict of interest and state that we have no real or perceived vested interests that relate into this participation, nor do we have any relationships with pharmaceutical companies, biomedical device manufacturers, and or other corporations whose products or services are related to pertinent therapeutic areas. Next slide. The task force also wants to acknowledge the current COVID-19 pandemic and the changing health center environment we're in. So thank you all to your frontline staff and healthcare providers during this unprecedented time. As you already know, health centers and the workforce play a vital role in the national response to the COVID-19 virus, in part by making patients aware of COVID-19 preventative measures and determining of patients needing COVID-19 testing as well as vaccination. Health centers are coordinating with state and local health departments as part of emergency management and response planning. So by continuing to provide primary care and telehealth to their patients, health centers have relieved congestion in hospital ICUs and emergency rooms that are becoming crowded with patients seeking care for severe and critical COVID-19 infections. We really want to let health centers know that 20 NCA organizations are currently and continuously compiling COVID-19 resources in the Health Center Resource Clearinghouse, which is available at healthcenterinfo.org. In relation to this webinar, there's a clear connection between COVID-19 and diabetes. What we do know is that people with diabetes are not more likely to get COVID-19 than the general population. People with underlying chronic medical conditions like heart, lung disease, or diabetes seem to be at higher risk for developing more serious symptoms and complications when infected with the virus. And if one's diabetes is well managed, the risk of getting severely sick from COVID-19 is about the same as the general population. So we just have this resource here and we hope that you're able to use it. Next slide. So for today's webinar, we have 3 learning objectives. Our first is understand the roles and responsibilities of the enabling services staff and how SDOH impacts diabetes management for special and vulnerable populations. The next, we want to describe 5 roles of the enabling services staff can play on the health center care team for special and vulnerable populations. And our last learning objective is that we want to introduce tools and resources to address health equity, the relationship to quality, and population health management for special and vulnerable populations. But before we get started with our content, we want to do a quick icebreaker. And I'm going to hand it over to Vanessa to get us started.
Hello, everyone. So like Robin said, we're gonna get started with an icebreaker just so we could get to know each other on this virtual um, scene. So if y'all could go ahead and type in the chat box your title, organization, and your location, so like where you're located, and then also your pronouns. And then after that, I'm going to go ahead and launch an icebreaker poll so we'll be asking, in your opinion, what's the cutest baby animal? All right, so I'm seeing a couple of folks from the Bay Area, like San Jose, couple RNs. All right, the chat box is filling up. So I'm gonna go ahead, well, y'all go ahead and type in your answers in the chat box. I'm gonna go ahead and launch the poll of your opinion of the cutest baby animal. So it looks like the baby donkey and the puppy are in close lead from one another. We shall see who ends up winning. All right, I'm gonna give the poll about 15 more seconds, so make sure y'all get your answers in, and then we'll see who wins. All right. So if you direct yourself to your eyes to the screen, you're gonna see that the cute puppy won the icebreaker poll, and then second was the baby donkey, the baby hippo, and the kitten. In my opinion, I think the hippo is pretty cute, but the puppy is cute as well. But alrighty, y'all. Thank you for participating in this icebreaker and getting to know one another, and like what your favorite animal was. I'm going to be passing it back to Robin to get started on the presentation.
Thanks, Vanessa. And we're going to actually relaunch the organization type poll. If you filled it out already, please don't need to fill out a second time, but we want to make sure we capture everyone who has attended since launching the poll previously. So Vanessa, if you can go ahead and relaunch that poll for us, that'd be great. And we'll leave that up for about a minute. I can't actually see who all is filling stuff in, but I'm quite sure that you all are getting to it. So with that, I am going to pass it over to Cindy, and we will close the poll in about a minute.
Thank you, Robin. Good morning, everyone. My name is Cindy Selmy, and I'm from Health Outreach Partners. And Robin and I are going to present this morning on learning objective number 1, which is understanding the roles and responsibilities of the enabling services staff and how the social determinants of health impacts diabetes management for special and vulnerable populations. Next slide, please. As we get started, I want to define what enabling services are. Enabling services have 15 categories as determined by our partners at AAPCHO. Enabling services are typically non-reimbursable and have been defined as non-clinical services that aim to increase access to healthcare and improve health outcomes. And diabetes is definitely one of the most important outcomes that community health centers hopes to address and improve. And among these services are health education, language interpretation, transportation, and other non-clinical services that enable people's access to healthcare. These 15 categories, as you can see on the slide, they seek to improve population and community health, as well as advance health equity, especially in vulnerable and marginalized communities. Next slide, please. So why are enabling services important, and particularly how do they improve diabetes care? As our payment methodologies are in transition and many communities and states move towards a value-based care environment, enabling services improve health outcomes. And in that type of payment environment, improved outcomes lead to higher reimbursement. And enabling services also seek to reduce costs. But more importantly, they treat the whole person. They not only focus on the medical manifestations of diabetes, but they seek to support people where they are by providing social services, improve access to care, and health education, to name a few. They also seek to improve the patient's experience overall. When patients are supported and engaged in their health care and feel good about their health care, they are able to better focus on treating and controlling their diabetes. Enabling services and enabling services staff also improve the provider experience. When providers are feeling supported and cared for, they have enhanced job satisfaction, and that translates into a better patient experience. And lastly, enabling services addresses the social determinants of health, which Robin will present on shortly. Next slide. Several years ago, AAPCHO did an accountability study which directly illustrates how uses of enabling services impacts diabetes care. As the data has shown that the more patients that engage and use enabling services and the health centers track the data, the A1C levels in those patients drop significantly. On this chart, you will see in the first section to the left that those where over 50% of the patients engaged in enabling services versus non-enabling service users, the A1C level dropped to below 7%. And as the chart shows, that as the numbers of patients dropped in utilization of enabling services, the A1C level has increased. And this is a perfect illustration that shows how enabling services and the staff support and diabetes care, as well as affect the outcomes. And thank you, Albert, for sharing the link in the chat towards that study. It's a very important study across the board. Next slide. So I just want to take a minute to talk about the quadruple aim. And what is the quadruple aim? The quadruple aim is a compass that has been adapted in healthcare or adopted in healthcare to optimize health system performance. And the four areas are improving population health, reducing the cost of care, enhancing the patient experience, and improving provider satisfaction. And in community health centers and across providers across our nation, when we are looking at these four areas and addressing them, we are able to affect and optimize healthcare for the positive. And this is true for diabetes outcomes as well. When we reach a level of equilibrium where we are addressing these issues, our community's diabetes outcomes improve and A1C levels drop. And we want to look at the performance in each of these and all components of this. And enabling services staff plays a very important role in each of these areas. And I will address that as we go on. Next slide. When patients are motivated and engaged in their care, diabetes outcomes improved. And ways that enabling services staff enhances this is through care coordination, education and engagement, access, such as improving transportation for patients in both rural and urban areas, through creating resources that speak to patients, and all of these together from the impact of enabling services staff and team members lead to better patient engagement and better outcomes. Next slide. Also, enabling services staff improves provider satisfaction. I'm a firm believer that all members of the health center team should work to their highest level of training and skill. And when they do, we support the medical providers. It has been shown through the data that one of the #1 causes of medical provider burnout and moral distress is feeling like they are not making a difference in patients' lives. And enabling services staff directly impacts that when we are able to provide social services, referrals, transportation, follow-up, and education for the patients. We support the providers. And furthermore, the tools that enabling services staff and the resources that they produce create higher quality care through case management, assure patients' needs are met outside of direct medical issues, and all team members feel satisfaction when they are working to their highest level of training. Another area where clinicians feel frustrated that leads to burnout is around EHR and administrative support. And when we are able to, through our enabling services team, address those issues, we improve provider satisfaction. Lastly, the value of the enabling services staff, which I have already mentioned to summarize, that they improve access to care and health outcomes. They improve the service delivery as well as the quality of care. Costs are reduced per patient, particularly when diabetes is controlled and A1C levels decline. Enabling services staff are trusted members of the community and often patients' first line of contact with their health center. Service delivery is improved, quality care is improved, as well as supporting health center staff and reducing burnout. I'm now going to turn it over to Robin, who will address health equity and the social determinants of health.
Thanks, Cindy. All right, so when we think about enabling services, we do need to remember that these services are addressing social determinants of health, or as we like to say, SDOH for short. For those of you not familiar with SDOH, they are the conditions in which folks live, learn, work, and play. These conditions are broken down into categories like economic stability, neighborhood and physical environment, education, food, community, and social context, and the healthcare system. Included in these conditions are racism and discrimination that all affect people's health outcomes. Things like maternal mortality, life expectancy, and health status are all outcomes based on how SDOH factors influence folks and the burden of disease for certain populations. Next slide. Another aspect in addressing SDOH is in thinking about intersectionality. Intersectionality was a term coined by Kimberly Williams Crenshaw, a legal scholar. As defined by Ms. Crenshaw, intersectionality holds the classical conceptualization of oppression within society, such as racism, sexism, classism, ableism, homophobia, transphobia, xenophobia, and classism, belief-based bigotry, they all don't act independently of each other. Instead, these forms of oppression interrelate, creating systems of oppression that reflects on the intersection of multiple forms of discrimination. So basically, they have overlapping social identities, minority identities related to systems of oppression, discrimination, and power. Intersectionality is a lens in which you can see where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem here, a gender problem here, a class or LGBTQ plus problem there. Many times that framework erases what happens to people who are subject to all of these things. For example, if you are a person of color, queer, and a woman, there's a multiplier effect in terms of your experience of oppression beyond just simply adding those marginalizations experienced by each of those three oppressed groups. She has a really great TED Talk, which we'll put the link to in the chat. And if you haven't watched it, I highly recommend that you watch it. It's called The Urgency of Intersectionality. But just some questions to reflect on are, what are the ways in which your own identities intersect? Another question could be, how might those identities allow for you to have privilege or feel oppressed? And another question would be, what are some strategies to have an intersectional approach in your work or environment? Now, the reason why I bring this concept into play is because, and you can go to the next slide, when we think about utilizing SDOH to address barriers of care for Black, Indigenous, people of color, we have to use an intersectional lens. There are Black queer folks, there's Black women, there's Indigenous folks who have disabilities, and all of these impact their ability to access healthcare and resources. So we put this slide here to really address some of the barriers and possible solutions for BIPOC in particular, and ways in which expanding enabling services can address those barriers. I'm just going to name a few that are on this slide, like economic stability. One barrier for BIPOC is that there's high medical expenses when you are uninsured. A lot of the folks who engage with enabling services often don't have enough insurance to pay the medical bills, and it results in social and provider deterrence in receiving the support that they need to manage their diabetes. A possible expansion of enabling services would be the use of case management and eligibility assistance. BIPOC have the ability to use their resources so that they can reduce the cost of medical expenses. That's one way in which we can address social determinants of health for economic stability. For education, in particular for BIPOC, a proportion of them have limited English proficiency, and this really affects their health literacy and understanding of how to manage their diabetes. And despite language barriers, functional health literacy within the whole BIPOC community is underdeveloped. Translation and interpretation services for enabling services is one solution in which we can think about expanding. And this can really be used to effectively communicate the importance of health-related information, increase health literacy. We can also think about trainings that we're doing and health education classes that are done in different languages so that it can increase health literacy and people's access to information and education. Another area when we think about this could be in the community and social context. A barrier for folks who are BIPOC would be diabetes management being often associated and or affected by stressors and inadequate support systems, whether it's social support systems or just support in general. And an expansion of enabling services would be really in developing community of structural competency folks, folks who have been trained in identifying structural barriers, building relationships with folks, and also recognizing discriminatory factors while utilizing environmental health risk reduction, and also addressing environmental racism, where folks live, work, and play, has a huge factor for communities of color. And so thereby addressing structural factors could help address diabetes management, in particular for Black, Indigenous people of color. So those are just some ways that we thought of, and we listed, a few more here, and we hope that it's helpful in thinking about barriers and strategies. And with that, I am going to pass it over to Hansel to share a little bit on our second learning objective. Oh, I just forgot we have a poll question. So before I pass over to Hansel, we have a poll question. So we talked about social determinants of health, and we just wanted to ask, in terms of stress and inadequate support system, which does that fall under? And if you want to launch the poll, that'd be great. So we have community and social context, food, neighborhood, and physical environment, and healthcare system. And we'll give folks about 30 seconds to respond to our poll. Should be real easy because I just talked about it. Vanessa, if you want to close the poll and launch it so we can see what folks said, that'd be great. Great. So 74% of you all said community and social context, which is correct. And for those of you who picked the other ones, if you want to just look back at our slides, that'd be somewhat helpful for you. But also feel free to ask me questions if you have some more questions about that. But with that, I will pass it now over to Hansel.
Thank you, Robin. So for this, for the next objective, we're going to go ahead and be focusing on describing 5 roles of enabling services staff and how they play, or how these roles play, excuse me, in the clinical team. So why utilize enabling staff on the clinical team in the first place? Can you go to the next slide, please? Well, as we have heard throughout the presentation, enabling staff have a great impact in improving the quality of healthcare services provided to vulnerable populations. This impact does not only affect the patient, enabling staff help improve overall population health and community capacity. They provide culturally appropriate educational material that is easy to understand. This helps increase communities' health literacy. A community that understands what is going on is a community that can stay healthy. Aside from affecting the community, enabling staff have a positive influence on how the organization is viewed by the community. Their hard work in the community increases the visibility of the health center that they represent. Aside from the community and the organization, we go with the next step is going to be the care team. So how does enabling staff affect the care team? They benefit from the knowledge, or the care team benefits from the knowledge the enabling staff have of their community. So enabling staff can assist by providing their opinion over interventions being offered and how to better market them to the targeted population. This helps with creating more effective care plans. And finally, at the bottom tier, we have the physician. Enabling staff assist physicians with translations or making sure that the patient understands the medical instructions. This ability to better communicate with the patient can assist with preventing medical errors, misunderstandings, and other adverse events. We have seen the impact of enabling staff having the community, organization, care team, and physician. Now, this is not only done by one individual. Enabling staff have different roles depending on the position. And now we're going to go ahead and discuss these different roles. You can go ahead and switch to the next slide. Thank you. So the first role that we show here is that of a community health worker. And that can be promotor de salud, a lay health worker, a community health worker. And the way that they impact diabetes is by offering culturally and linguistically appropriate information to assist with lifestyle changes and behavior. This can be by providing maybe some low impact type of exercises, maybe assisting them also with the steps on changing a habit. So things like that is what a community health worker would go ahead and do. The next role that we have is that of a caseworker. And this is anything having to do with mental health, substance abuse case manager. You could also have a health coordinator, a medical home coordinator. And this, when it comes to diabetes, can be overseeing and coordinating of all the services received by someone with diabetes. The next position that we have here is that of a patient and community education specialist. We have the different sub roles that this would account for, which is your peer educator, your health educator, your health coach, your lifestyle coach. And the way that this affects in diabetes management is that it increases the knowledge on health and other topics on chronic diseases, mental health, and addiction. You can go to the next slide. The next role that we have is that of the outreach worker. The way that this position affects diabetes management is that they basically help inform patients about assistance programs that might be available in their communities. The next role that we have here is that of the eligibility assistance worker. And this can be anything from a navigator to an eligibility assistance specialist. These individuals, they facilitate the completion of applications for services such as insurance, applications for food assistance, financial assistance. They ensure that there is a clear communication between all parties that are involved. Can you go ahead and scroll? There you go. The last role that we show here is that of the interpretation worker, which can be your translator or your medical interpreter. This position assists in diabetes management in explaining doctor's instructions and medication prescription. So they can go ahead and ensure that there is a clear communication between all parties involved. You can go ahead and scroll to the next slide. And then the final two positions that we're going to be presenting today is that of the transportation worker, which is the individuals that can drive the patients to and from their medical appointments. These individuals can also be assistance offered through Meals on Wheels. It could also be assistance in delivering food or taking them grocery shopping. And then the last position that we have here is that of a legal aid, an MOP worker. A sub role for this would be someone maybe working as a housing legal aid worker. And the way that they assist is they can assist with legal issues, unsafe living conditions, unlawful evictions, etc. So you can go ahead and scroll to the next slide. At this moment, we're going to go ahead and launch a poll. That poll is going to be, does your health center organization utilize enabling services staff to assist with diabetes management and control? So you can either choose yes, you do use enabling services staff, no, you don't use enabling services staff, or you might have enabling services staff, but not use them for diabetes management, or the last option would be I'm not sure. So you can take some time to go ahead and answer that for us. That way we can have an idea as to how you guys are utilizing, or if you guys are utilizing enabling staff at all. So we're going to go ahead and wait a couple of more seconds as we allow you guys to go ahead and answer that poll for us. Okay, I believe that should be sufficient time. If you want to go ahead and show us those results for the poll. There we go. So we see that 71% of you guys do utilize enabling servicing staff for diabetes management. That is great. That is great to hear. Then we have about 14% of you guys that don't. 9% of you guys do have enabling servicing staff, but you don't use them for diabetes management. And then we have here 6% of you guys are not sure. So thank you, all of you guys, for participating. It does help us have a bigger picture, a clearer picture as to who are the health centers that we are interacting with. So moving forward from here, we can go ahead and discuss the core competencies that these individuals should have. So you can scroll to the next page. Thank you. So core competencies encompass the knowledge, skills, characteristics, and personal attributes that enable individuals or organizations to perform effectively in a particular profession or a situation. Modern management theory argues that a business must define, cultivate, and exploit its core competencies in order to succeed against the competition. In this case, core competencies are essential in improving quality of health, in-house operations, and consequently improving client and patient success. The following are core competencies that have been identified as essential for enabling staff to possess. So we're going to go ahead and touch base on some of them. The first one that we're going to go ahead and touch base on is going to be outreach methods and strategy. So this is basically, if you can go ahead and scroll back, this is the process of contacting, engaging with, and helping people to learn about and use resources to improve their health and well-being. So an example of this can be maybe increasing the visibility of the health center or this community health worker service within the community, for example, participating in the community health fair and local events. So by the individual being out in the community, they themselves basically provide more visibility of the healthcare. So the individuals must have the ability to go out and outreach. The next core competency that this enabling staff must have is the ability of individual and community assessments. Individual and community assessments are the collection, synthesis, and use of information to help understand the needs, the strengths, and resources of individuals and communities served. The information collected is used to strengthen, plan, and implement effective initiatives, programs, and resources based on expressed priorities. So an example of this can be conducting an assessment to identify the needs of a community, like I mentioned, connecting with people living with diabetes and identifying their specific needs to develop an effective program or initiative. Another core competency that this individual should have is going to be effective communication. Effective communication is effective and purposeful communication is listening carefully and communicating respectfully in ways that help build trust and rapport with patients, care team, community members, and other professions. An example of this could be use a variety of educational methods to reach patients from various cultural backgrounds. An example, when community health workers work with patients to improve eating habits, they must be familiar with traditional cultural dishes and healthy replacements their patients will actually use. So you want to make sure that if you're going to offer them a certain alternative, that it is an alternative that goes with some of their culturally appropriate dishes. Another characteristic is going to be cultural responsiveness and mediation. This is the ability to educate and support providers in working with clients from diverse cultures and help clients and community members interact effectively with professionals working in different organizations to promote health, improve services, and reduce disparities. So this can be address community perspectives or misconceptions on diabetes medication and management. Another core competency is going to be education to promote health behavioral change. So this is the use of education to promote health behavioral change, is providing individuals with information, tools, and encouragement to help them improve their health and quality of life. It includes working with patients closely to identify barriers that affect their health behavior. This can be help patients see their health as a priority. For example, in many cultures, women are caregivers of others and not used to taking care of themselves. So all of these are core competencies that individuals should have when it comes to being an enabling servicing staff. So we can go ahead and before we move on forward, when utilizing core competencies, it is important to keep in mind the following. Core competencies do not establish baseline performance. Rather, they are used to raise the bar of an employee performance. They provide employees with roadmaps to increase their capabilities incrementally. Competencies reflect the organization's strategy. That is, they are aligned in the short-term and long-term missions and goals. Competencies focus on how results are achieved rather than merely the end result. It is in this manner, they bridge the gap between performance management and employee development and are an integral component of personal development plans. Competencies close the gap between skills within the organization, and competency data can be used for employee development, compensation, promotion, training, and new hiring selections. So you can go ahead and move on to the next slide. So before we, to finish this, we want to go ahead and provide you guys with some tips and pointers for working with enabling staff. We do recommend that you guys provide training and professional development For this enabling staff, remember that enabling staff are not medical staff. They need training and supervision if more technical things are going to be needed from them. Interviewed entities who use enabling services staff identified training and professional development to be an important factor to ensure the success of the enabling services staff in integrating with community with care teams. At the same time, having established roles helps to identify opportunities for training and professional development. We also recommend that you share the success of this enabling staff. Share the grow. Enabling staff is a growing and promising field. By you guys sharing the benefits and the successes that you have, it increases and allows others to see the benefits of employing this enabling staff have. We also advocate, or better yet, we also ask that you guys are advocates for enabling servicing staff when possible. Having support of the leadership members or medical providers is essential to strengthening enabling service as a profession. Further, receiving support from professionals fosters respect and increases the trustworthiness and credibility of this enabling services staff. Develop core competencies. This assists in the evaluation of the position. It helps you measure success. Having set roles aids in the evaluation of the enabling services performance and quality of work, as it could be used as a standard to measure their success in this position. Setting clear enabling roles for the enabling services staff helps draft and define the job position description, as they are able to include required duties that align with the organizational goals established through the core competencies. And the last thing that we ask is to involve your staff in your meetings. By involving this enabling servicing staff in your meetings, it allows them to be validated. It also allows them to share their experiences, making their value more available to everybody in the staff. Enabling services staff can become the eyes and ears of clinical team. They provide insight from their encounters and have a lot of knowledge from first-hand experience with that community. So you can go ahead and move to the next slide. Thank you.
Thanks, Hansel. And with that, we will move on to Albert, who will share our last learning objective.
Thank you so much, Robin, Hansel. So I'm going to be joined by Dr. Irene Hilton from the National Network for Oral Health Access to kind of give you all kind of a series of tools and resources that you all can take back to your desk, teams, and leadership, so that you can really implement the enabling services workforce to help, again, address diabetes management, but also the social determinants of health, as my colleagues mentioned from HOP and MHP Salud. Next slide. So one of the first things I want to highlight is really looking at kind of your enabling services workforce and the job descriptions that they are kind of working under. And so our folks at the National Association of Community Health Centers have recently developed job descriptions, and 3 of them focused on outreach and enrollment, care coordinators, and CMS funded navigators, which I'll give you all the link in the chat box there. It's something from a workforce development perspective to kind of refresh and make sure that your ES staff are, as Cindy mentioned earlier, performing to kind of top of their licensure, for lack of a better word, because they are doing amazing work within the clinics and also outside of the clinics. And to some of the questions in the chat box and Q&A, reimbursement, we have to keep demonstrating the value of the enabling services workforce, because they're doing so much for our patients and our communities, and they really do help address some of those health inequities in the local community neighborhoods. So that's available for you all to look at. Next slide. In terms of if you are a primary care association, so these are HRSA funded associations in all 52 states and territories, including Puerto Rico and the Pacific Islands. There was a series of podcasts that were developed in 2019, and this is really a good primer or introduction to those of you still unfamiliar with the enabling services workforce, the value of enabling services. And it really talks about, again, as Cindy mentioned, the value-based care piece, because we are seeing more and more reimbursement conversations happening in different states on how do you pay for the community health workforce, the care navigators, the health educators. And I know there was someone in the chat box that talked about a CMS contract that they were able to leverage for care educators and healthcare workforce. So please do look into your CMS or Center for Medicaid and Services funding in your state, because that's definitely something that's coming out and rolling out each and every year in different states. Next slide. And now I'm just going to go through a series of resources from the 4 national partners here on this webinar today. So for those of you not familiar with AAPCHO, or the Association of Asian Pacific Community Health Organizations, we're HRSA funded to really address the needs of the Asian American, Native Hawaiian, and Pacific Islander community. So our website has a bunch of resources on how to address kind of the racial and ethnic and cultural components for Pacific Islanders, Asian Americans, and Native Hawaiians. And we have a lot of webinars and resources available to you to look at as an archive. And if you have any more questions, feel free to reach out to us. Next slide. And for our partners at the Health Outreach Partners, they're HRSA funded to focus on the migrant seasonal agricultural worker or farm worker health. And they have great resources also on the value-based care piece and how you can deploy and leverage your enabling services staff to really, again, address diabetes, social determinants, and any of those barriers to care. So that'll be available to you all in the slide deck as well. Next slide. And then a shout out to our partners, so Hansel and the MHP Salud team. They do amazing work on the community health worker program, Promatoras. And so they have, what I really love is the ROI, or return on investment educational toolkit. So that's really a way to demonstrate to payers, to policymakers, what the CHW workforce brings to the health center. And so there's, again, core resources and tips on how you can demonstrate that impact available on their website as well. And that really relies on the data that you collect in the health center. So we know that health centers are collecting the full-time equivalent, or FTE, on an annual basis. But for the Enabling Services Accountability Project that Cindy mentioned, that AAPCHO had led in a research aspect, we want to document, for example, the number of encounters, the number of minutes that your enabling services staff are spending with patients and community, because those numbers are going to really demonstrate the value. For example, we know that some health educators are spending 30 minutes or more with a patient on their diabetes and other social determinants of health that, again, affect their diabetes. And so by having that kind of concrete data in your EHR or even on paper, that's going to be the conversation starter when you're talking to the health plans, the payers like Medicaid, and also your policymakers who kind of inform the way reimbursement is given out in different states and regions. So the more data that you collect, be sure to look at that data and work with your health IT staff to create meaningful reports, again, for your staff and for your leadership, because that will, again, in turn, have that return on investment. Next slide. And I'll pass it on to Irene here.
Thank you, Albert. We just wanted to present a few resources. If you attended any of this webinar series in the past years, you've learned that there is a relationship between an individual's oral health, mouth status, especially if they have gum disease, and their ability to have good glycemic control or A1C level. And because of this, most patients that have diabetes should be seen by a dentist, but it's really difficult. It can be really difficult to access dental care, especially for adults, depending on your state scope of Medicaid. And that's why enabling services, we found in our work that health centers that use their enabling service staff that are part of the diabetes team to help patients access dental care, which may or may not be within the health center, could be outside, are really have better outcomes. And so we have 2 slides here, and this first slide just shows some of the resources that we've developed at NNOHA to integrate oral health into primary care and into management of diabetes. Next slide. And this slide specifically, if you are planning or you are using your enabling services staff to assist with care coordinating or guiding, managing patients with diabetes into the dental care delivery system, which again can be very, very complex and varies by state. There is a curriculum with various small modules for frontline health workers from Smiles for Life at this link that people can get trained on just some of the basic clinical terminology for dentistry. And then there's patient handouts and other online education that your enabling services staff can use with working with patients in order to help them, patients with diabetes, access dental care, which again is really a critical part of their overall diabetes treatment plan. Next slide. There's also resources on the NAC Health Center Resource Clearinghouse. So if you go on there and you click on in the different clinical issues, you will see, again, more resources on COVID, on social determinants of health. And so again, if you're looking for other resources for enabling services staff, you can find that here. Next slide. And now I think I'm going to turn it back to Robin to moderate our Q&A.
Thank you so much, Irene. So we have a few minutes left, and I know that Albert has been sharing a lot of links, but those links are also on our slides as well, and we will make sure to put them in our follow-up email. But with our last few minutes, we have time for maybe like 1 or 2 questions. Do we have any questions, Albert?
No questions. I know we've been answering them as we've gone through the webinar. So great work, team.
That's right. Thanks,
Check
team.
out the Q&A. Yeah, you should be able to see the transcript in the Q&A pod for you all.
All right. Well, if we don't have any new questions, let's go to our next slide. So this is just a link to our survey. It will direct you to complete the survey when you close out of the webinar, but if you don't have time, please click the evaluation link that's in our chat. It's also on our slide. You can take a picture of the QR code. There's many ways and many options to fill out this survey, but please do get a chance to fill that out so we can get your feedback and we can hear back from you as to what you all appreciated and what things we can do better. Next slide. And as our final slide and reminder, we do have another webinar next week. It will be on Wednesday, October 27th, 11 a.m. to 12 p.m. Pacific Standard Time, 1 p.m. to 2 p.m. Central Standard Time, 2 p.m. to 3 p.m. Eastern Standard Time. You can register at our website at CHC Diabetes, and the topic will be on developing patient-centered resources for diabetes care. I highly recommend that you all register for it and continue in our learning series. And next slide. This is just all of the webinars that will be happening for our learning series. As I mentioned, we will have another one next week. There will be a 3rd webinar on November 3rd, and then a 4th webinar on November 10th. And that webinar on November 10th will be in Spanish. So for those of you who would welcome a webinar that is done in Spanish, please do highlight that, put it on your calendars and register through our website, chcdiabetes.org. Next slide. And if you need any of our contact information is here. And once again, our slides will be sent out to you all. But if you have any other questions that come up post-webinar, please feel free to reach out to any of us. We welcome any of your questions. And thank you all so much for attending our webinar today. And with that, we will end our webinar, and thank you all for attending.